welcome to this edition of Northwest Newsweek. A new case of COVID-19 in the Dryden-Red Lake region makes 13 active cases in the Northwestern Health Unit's catchment area. And earlier this week, a pair of COVID-19 outbreaks were declared in Kenora after the 10th positive case was confirmed. The Northwestern Health Unit says the two cases announced earlier this month at Valley View Elementary School have now met the definition of a school outbreak because at least one of the cases could have reasonably acquired the infection in the school setting. So far, there are no additional cases and no more classrooms have had to be closed. Meanwhile, one staff member at the Birchwood Terrace Seniors Home in Kenora has also tested positive. Under the province's guidelines, it only takes one case in a long-term care home for an outbreak to be declared. Birchwood Terrace officials say the case was identified during routine weekly staff testing. The affected employee is isolating at home, and any residents who may have been exposed to the staff member have been swabbed. So far, there are no residents or staff who are displaying any symptoms. It's a decision that the Anishinaabe-Aski Nation is applauding, calling an example of the need for a complete transformation of the justice system. 6 members of Pikangikum First Nation who face intermittent 30-day sentences for impaired driving have won a landmark Charter of Rights and Freedoms challenge. In a decision that took almost 8 hours to deliver, Ontario Justice David Gibson found there is a legal regime that treats members of Treaty Number 5 as second-class citizens. To serve an intermittent sentence, the 6 women would have to travel to and from their remote flying community to the district jail in Kenora each weekend at personal cost. Gibson acknowledged that Pikangikum is a textbook example of the negative effects of colonialism and found the unavailability of an intermittent sentence to on-reserve members of the Pikangikum First Nation and those similarly situated for violation of the mandatory minimum sentence provisions of Section 225 of the Criminal Code violates Section 15 of the Charter. Karen Seeley is a lawyer who represented 2 of the women during the challenge. She says while her clients will still have to serve their sentences, there are other cases waiting for this decision.
Grant them a different sentence because on the second day of submissions in November 2019, the provincial crown undertook to transport our clients from Pikangikum to Kenora for each and every visit that they must do to serve an intermittent sentence. But this was only with respect to these 6 women. So this doesn't exist for any other person. So there was still an issue that was very live and very important for this area.
Seeley adds the province is looking at keeping occupancy rates low in correctional facilities due to COVID-19. So many facing intermittent sentences have been permitted to arrive at the jail, receive a temporary absence, and then serve their sentence at home under strict conditions. The province has 30 days to appeal the decision. Meanwhile, the court ruling was brought up at Queen's Park. Kiiwetinoong MPP Sol Mamakwa cited the findings of Justice David Gibson and asked the province to honor his decision and adopt changes to fix its colonial ways of dealing with Indigenous people in the justice system.
David Gibson's decision reaffirms the need for transformation of the justice system as it pertains to First Nations offenders. Offences that would result in a fine or a warning anywhere in Ontario result in jail time.
We've worked with Indigenous communities to expand and create programs that address the overrepresentation of Indigenous people in the criminal justice system, such as the expansion of GLADU courts and restorative justice programs.
There's growing concern over the future of ambulance bases in the Thunder Bay District. On a recent conference call with a consultation firm, several area mayors discovered a proposal to close or merge some stations and reallocate ambulances to a different station. As Adam Riley reports, these proposals are all receiving mixed responses.
Red Rock Mayor Gary Nelson says his community is often left without an ambulance due to patient transfers from the Nippic and Red Rock area to Thunder Bay, which sometimes is extended beyond the 2-hour travel time.
And then while they're in Thunder Bay, they could get a call because the ambulances in Thunder Bay are all busy, so they could be put out on a call up there. But we don't know when this ambulance is going to be back in Red Rock.
Red Rock has a single base station and is supplemented by the nearby Nippigan base. However, Nelson says that puts the residents of his community at risk due to the limited road access to Red Rock that includes one rail crossing. But he is open to the proposal heard during a Zoom consultation call with the firm Performance Concepts Consulting and Superior North EMS to build a new base on the highway between the two communities.
We can't have an ambulance, both ambulances situated in Nippigan Hospital. Not with the elderly people we have here in Red Rock and the 2 schools and the buses that are coming in that highway all the time and across the railroad tracks. We need an ambulance close by. So halfway between Nippigan and Red Rock, I think would be great. Red Rock has the property for them. We will give them the property if that's what they need.
The situation is similar further east on the North Shore. Terrace Bay Mayor Jody Davis says, like the Nippigan Red Rock area, both the station in Scriber and Terrace Bay are proposed to be closed, with a new base being built between the communities. A proposal he is approaching with some skepticism.
That's quite a reduction in services and coverage. They're at this time saying that the service will stay the same, but just have one building. Well, the proof will be in the pudding and how they're going to do that.
Davis adds there were some other service changes mentioned during the consultation that left him a bit taken aback, but he wasn't overly surprised by the proposals.
One that is really hard to handle is the closing of the station at Beardmore, considering the distances that the people will have to travel now to get an ambulance and delay in time.
TBT News reached out to Superior North EMS for a copy of the presentation that was broadcast during the consultation, but received no response. Adam Riley, TBT News.
The Laxville Police Service has laid 15 charges against a Kejik Bay man following an investigation into a sexual assault and forcible confinement incident. Officers executed a search warrant at a residence in the community on Monday and seized a loaded firearm and ammunition. Some of the charges faced by the 59-year-old include assault with a weapon, sexual assault, forcible confinement, and 5 separate firearms-related offenses. Laxville police are continuing to investigate and believe there may be additional victims who have not yet come forward. Despite some delays due to COVID-19 gathering limits, residents in Kenora are one step closer to knowing where the new All Nations Hospital will be located. Discussions on the project have been ongoing for years and will replace the aging Lake of the Woods District Hospital. The original Royal Jubilee Hospital was built in 1897 and for the last 123 years has been added upon to create the current facility as it sits now. CEO Ray Reset says there are several locations being looked at, including the current location of the district hospital, and the viability of each site will be graded based upon 8 pieces of criteria.
Even this site will be very strong in some areas and it'll be weak in other areas. A new site, let's say, that had nothing on it, you have infinite number of options in terms of how you might tackle it from a space point of view. But then it'll score lower on some other things. If it's not on water, it'll score lower. If it's not by a medical clinic like ours right here, it'll score lower because we have doctors that come from that clinic and come into here for obstetrics and so on, are right beside it.
Reset adds, despite its age of the structure, the current hospital is in good condition and its use could continue beyond the construction of the new facility. The location sites are anticipated to be released to the public for further comment later this month. And there's a new frontline organization geared towards addressing the care needs of Kenora's less fortunate. In its 6-month pilot, Compassionate Kenora hopes to fill the gaps in care for the homeless. However, some feel that while it's a needed service, it's just not in the right location. Corey Nordstrom reports.
Compassionate Kenora has opened its doors in the city, its mission to provide social and medical support to Kenora's most vulnerable. Dr. Johnny Greck is one of the organizers of the clinic and its primary physician. He says they are developing programs for arts and food service and have set up computers with access to the internet for patrons to connect with friends and family, as well as apply for work and treatment programs. But he says that is just the beginning.
And that's trying to attend on a weekly basis for me and on a daily basis for 2 of the nurses who are here to the needs of this group that we identify. So that could be anything from wound care, broken leg, all the way through to helping with mental health or access to treatment for their addictions. The whole spectrum that you would see in a family practice.
Greck says Compassionate Kenora is part of a 6-month pilot project, which is funded through donations and the Lake of the Woods Community Foundation to augment existing supports for Kenora's homeless population. A 2018 survey found there were 223 people who self-identified as homeless in the city. However, there is a bag of mixed feelings among the business community who operate along Main Street.
There's already a lot of locations on Main Street that aren't retail, and I don't think that it works to attract what we need. So for our business, it's not a compliment to our business. Let's put it that way.
It's a good idea for sure. We definitely need some support in this town. I don't know about location being the best, but any help is good help. So,
as a business owner, it is great to have more retail spaces filling Main Street because it is the main drag as far as retail is concerned. But I'm also a big fan of just building community, and I think that this is something that will be very positive and favorable.
Grech understands those concerns and is willing to listen and collaborate as things develop.
If indeed people are saying, well, we're really not happy that you're here, or you really have attracted too much unwanted attention, I will accept that, absolutely, and then we'll just have to say, well, please help us to find an appropriate location which doesn't give you that sense of safety concerns.
But until then, Grech and his colleagues intend to continue what they are doing, helping those in need. Corey Nordstrom, TBT News.
When we come back, a marathon doctor is lobbying the federal government to allow him to take specific training to better help his terminally ill patients. Patients who have been diagnosed with a terminal illness often deal with anxiety regarding their diagnosis. In August, Federal Health Minister Patty Hajdu announced exemptions to allow access to magic mushrooms for end-of-life distress. The move was celebrated by many doctors, including some here in the Northwest, but some doctors are now asking the government to go one step further and allow them to try the drug before advising it for their patients. Adam Riley reports.
You basically go through the experience of what your patient will be going through. So you experience the altered state of consciousness.
Dr. Ryan Patchett-Marble is a physician based out of the Marathon Family Health Team who has a patient who is dying due to a terminal illness and, like many facing an inevitable death, is experiencing mental distress as a result, and normal treatment options are just not working.
So that means medications like antidepressants, anxiolytics, psychosocial interventions like counseling. Studies show those generally aren't effective, or if they are, it's not very much. And this person has tried those and failed those options.
However, this patient has the option of using psilocybin or magic mushrooms as a recently approved method of treatment by the federal government. Patchett-Marble is one of 5 Northwestern Ontario physicians who are lobbying the federal government to allow them access to use the mushrooms themselves. He says by allowing doctors to take training and experience the effects, it will make it easier to help patients through the treatment.
This is not like when I prescribe antibiotics for a urinary tract infection. I don't need experience with the antibiotics. That's prescribing. This, I think, is more akin to being a guide. And if you think of any other analogies of a guide, you want your guide to have personal experience in the terrain they're guiding you through.
Patchett Marble equates the situation like going on a safari. Do you use the guide who knows everything but has never stepped foot in the region, or do you go with the guide who has experienced the region firsthand? Federal Health Minister Patty Hajdu was unavailable for an on-camera interview. However, a spokesperson for her office did offer this statement regarding the request by the doctors. Health Canada thoroughly reviews all requests for exemption and makes decisions after taking into account the risks and benefits. We still have much to learn about the risks, which is why the sale and possession of psilocybin is still illegal. Until there is sufficient evidence base, Health Canada will review each request for an exemption on a case-by-case basis. Patchett Marble hopes the government will accept their case soon due to the amount of time his patient and others have left.
There's all these patients now lining up to get it, but there's very few people trained properly to actually provide it. And I think we need to look at that next. And I'm hoping that the Honourable Patty Hajdu will seriously consider granting the Section 56 exemptions for physicians and therapists so that they can get the training they need to provide the treatment properly and get the best benefit for these terminally ill patients suffering.
Adam Riley, TBT News.
Ontario Provincial Police may assume policing duties once again in the city of Dryden. This comes following a motion requested by the city's mayor during last month's city council meeting. This would mark the second time in 3 years that the topic would be broached in the city. In 2017, council requested a costing that took 2 years to complete, creating unease within the ranks of the Dryden Police Service. It ultimately ended with a new council voting against making the switch. However, that decision was not unanimous, as Mayor Greg Wilson was the lone vote to go with the OPP. Wilson says at the time, council couldn't justify the $4 to $5 million transition cost. Now, he says the community is in much better financial shape. He adds the impacts of COVID-19 played a role in his decision to put forth the idea once again.
When that hit us in March, it really became clear that the world shifted, and even small towns are being impacted. So that includes impact to police departments. So now more than ever, it's really the depth of services and scale of operations that you look at and say things have changed. We need to take another look at that. So that's what I'm recommending that council do, is take a look at it again.
Wilson says the motion will be voted on during the October 26 meeting. Should it pass, like the previous costing request, committees will have to be created and public meetings will be held. However, he understands that could be difficult with COVID-19 gathering restrictions. A member of Dryden's Ontario Provincial Police Detachment has received some recognition for his efforts to stem the flow of illegal contraband along the Trans-Canada Highway. Sergeant Christopher Wood has spent the last 12 years with the OPP, and during the last 5 has helped seize an estimated $11.5 million in illegal tobacco, firearms, drugs, and cash. He recently received accolades from Ontario's top cop, OPP Commissioner Thomas Carrick. Wood says while he is humbled by the recognition, he considers himself just one part of a much larger group effort.
I mean, the success that we have had here collectively involves many different officers from numerous different police agencies in Ontario, in Canada, and south to the United States. We have officers, from police agencies everywhere in between, who are continuously engaged in criminal investigations of this sort.
Wood says his skills did not appear overnight and came through years of training and experience from past officers. He adds that he's now helping the next generation of officers with similar training. For the Ford government, COVID-19 has been a real eye-opener for the needs of Northwestern Ontario's highway users. Restaurants and truck stops were forced to turn people away in the early days of the pandemic, leaving truckers to depend on provincially run rest stops that weren't always up to par. On Friday, Transportation Minister Caroline Mulroney was in the Thunder Bay area to announce improvements to many rest stops across Northern Ontario.
I am very happy to announce that we are adding new rest areas and expanding existing facilities along provincial highways.
Mulroney says over the next few years, her government is repairing or expanding 10 existing facilities, including the rest area in Rossport and the one along Highway 17 between Uppsala and Ignace. On top of that, 4 new rest areas will be built along Northern highways.
The Government of Ontario asked Ontarians to stay home businesses were closed, and much of the economy came to a standstill except for our truck drivers. It was essential for our government, both from an economic standpoint, but as I mentioned in my remarks, from a just basic humanity, to make sure that we provided the infrastructure that was necessary for truck drivers to continue doing their job.
And I can assure you, today's announcement will impact positively thousands of truck drivers from coast to coast who come from the west to the east. This highway, this connection, just isn't for Ontario. It is the hub of the freight between the east and the west. It's the link.
The 2 new rest stops in this region will be built on Highway 17 near Terrace Bay and Highway 599 near Pickle Lake. And coming up after the break, a woman in Dryden catches the start of a very unusual friendship. Well, it looks like something you might see in a Disney movie, but a woman in Dryden was shocked to see her cat getting some grooming done by a few deer.
So they have now adopted our cat as one. Flambeau, you made your way in there, pal.
A budding friendship with a group of deer means Flambeau the cat may need to spend less energy grooming herself these days. As Terry Randell discovered on Monday, the deer are helping her felines fur stay clean. Flambeau became comfortable with the animals visiting the front yard this summer, but Randell was surprised when she spotted the deer licking the cat as she laid on the grass. Randell says anywhere from 2 to 6 deer frequently come to her yard where there's an apple tree, but they don't usually get so close to her 1-year-old kitty. With winter temperatures on the horizon, many who pursue an active lifestyle will be forced back inside to pools, gyms, and indoor rinks. Adam Riley takes a look at what the Northwest's 3 largest communities have planned for this transition.
Despite the uncertainty that COVID-19 has created around indoor sports, it appears things will be a go this season at the arenas and pools in Kenora, Fort Frances, and Dryden, with some obvious conditions. In Kenora, the city's main complex, the Kenora Rec Center, is already open. However, there was a technical issue with the Keewatin Arena as the ice plant compressors required some work. Mayor Dan Reynard says work is already underway, but the city is waiting for feedback from its user groups like boys minor hockey.
That will dictate when we open the Keewatin Arena. There's been talk that we're not going to open. That isn't, in my mind, I firmly believe that we'll probably be up and running at some point, either between Thanksgiving and the end of October. But you know, we'll have more ideas. Minor hockey's registration closes at the end of the month.
Meanwhile, in Fort Frances, council recently voted on an extra user fee of $7 per user to accommodate for the increased cost for sanitation of the facility. However, Mayor June Call says some on council wanted to charge extra, but she says especially now, it's hard for some to afford those costs.
I know one family, there's 3 children in that family. If you've got that many or more children and they're all playing hockey or they're all involved in activities there, it weighs on their pocketbook as it is. So I'm glad that we came up with a compromise, and hopefully all the residents who are using the Sportsplex will be fine with that.
And finally, in Dryden, at both the pool and fitness center and the arena, it will be an enhanced state of business. Cleaning schedules have been bumped up, and physical spacing between the equipment and on pool usage has been increased to allow for social distancing and the aforementioned cleaning schedule. Community Services Manager Stephen Belanger says they are taking in a phased approach with safety top of mind.
We're going to be starting off with Rink 1. We've got a solid return to play guide that's been distributed and being absorbed now by our user groups. So it's going quite well. And as soon as we have, we're looking at a nice installation date of November the 1st or November 2nd for Rink 2.
Belanger says with just 3 rinks in the entire city, it might be difficult to accommodate for all user groups. But with high school sports sidelined for now and the SIJHL season currently in limbo, there should be still space available for all. Adam Riley, TBT News.
That's all for this edition of Northwest Newsweek. Thanks for watching. We'll see you next time.